Hello, my name is L'Oreal Henderson, and today I will be presenting my health assessment video for my Nursing 242 class. So the first thing I will do when entering the room with the patient is I will perform hand hygiene. Next, I will introduce myself. Hi, my name is L'Oreal. I'll be your nurse today. How are you?
Doing good.
Okay. At this moment, I will ask the patient his name, birthday, and in some situations, I will say, may I look at your wristband?
Yeah.
I will look at the wristband to confirm their identity. I would also ask if they could tell me what year it is, who the president is, just so I can kind of get a baseline of where their alert and orientedness is. Okay. And next, I will explain the process to the patient. Hi, so today I will be doing a health assessment intake with you. So basically, I'll be asking you some questions about your health history.
Okay.
And so we'll go ahead and get started. And what I'll do is close the door to provide privacy, or if there's a curtain, I'll close the curtain. All right. Could you tell me how old you are?
35.
Thank you. And what do you identify as?
Male.
Great. And what is your marital status?
Married.
Married. Okay. And what do you do for a living?
I'm a chef at a retirement community.
Okay, nice. And could you describe your living situation for me?
Live at home with wife and kids. Single family home.
Okay. Do you feel safe at home?
Yeah, absolutely.
Okay, good. Would you be needing an interpreter at any time today?
No.
Okay. Next, are there any types of medical treatment that you do not accept due to religious or cultural reasons?
I am one of Jehovah's Witnesses, so I don't accept blood transfusions. I do have documentation with me that provides any specifics.
Okay, and we'll be sure to add that to your chart at the end. Okay. Are you currently taking any medications?
No.
Okay. Are there any supplements that you take on a daily basis?
Just over-the-counter vitamins.
Okay. Like a multivitamin type?
Yeah.
Okay, great. Do you have any allergies to food?
No.
Any foods? Okay. Any medication allergies?
Not that I know of.
Okay. And can you kind of give me a brief health history for your background?
I guess I've been pretty healthy most of my life. I've broken a few bones over the years, but nothing really major.
Okay. Any surgeries?
Yes, I have had 2 nasal reconstructive surgeries.
Okay.
When I was a kid.
Okay. And could you give me a background of your family health history?
Got heart disease on both sides. Believe I have like diabetes on my dad's side, high blood pressure.
Okay.
Some things like that.
All right. Next, I'm going to review your body systems. Okay. So I'll just be asking a few questions about each one.
Okay.
Okay. We'll start with the neurological system. Are you currently having any pain or discomfort?
I got some back pain.
Okay. How long has that been going on?
Right now for the past week or so.
Oh, okay.
Off and on for the past year and a half.
Okay. Do you have a history of seizures?
No.
Oh, okay. Do you have any weakness or tingling in your fingers or toes?
No.
Nothing like that? Okay. Any history of mental health illness for you?
For me personally, no. I had ADHD when I was a kid, but
okay.
That's about it.
Any thoughts of harming yourself or someone else?
No.
Okay. Next, we'll talk about your respiratory system. Do you have any breathing issues, any shortness of breath?
No.
Okay. Have you ever been diagnosed with asthma?
No.
Okay. Do you currently vape or smoke?
No.
Okay. Does someone in your home vape or smoke?
Nope.
Okay. We'll move on to cardiovascular system. Any chest pain with activity?
No.
No chest pain. Have you ever been told that you had high blood pressure or low blood pressure?
No, it's been pretty good.
Okay, good. How would you describe your exercise?
Maybe once a week on average.
So about 1 day a week?
Yeah.
Okay. All right. Moving on to your gastrointestinal area. Do you suffer from any stomach issues?
I do have IBS.
Okay. How long have you had that?
About 3 years.
Okay. IBS with diarrhea or constipation?
Constipation.
Okay. Are you currently under the care of a doctor for that?
No, not right now.
Okay. And when was your last bowel movement?
2 days ago.
About 2 days ago? Okay. All right. And how would you describe your diet?
I could eat better, probably. I don't eat a lot of healthy foods, but I try to eat some fruits and vegetables a little bit every day.
Okay. All right. Next, we'll move on to the genital urinary system. Do you have any problems urinating? Any pain, discomfort, burning?
No.
Anything like that?
None of that.
Okay. Do you feel like your urine output is kind of equal to your input? Like how much you drink? Does it seem kind of like it balances out equally?
I think so, yeah.
Pretty close. Okay. Okay. Any problems with like sexual performance?
No.
Okay. All right. Moving on to the musculoskeletal system. Do you have any problems other than your back with your bones or muscles?
No, pretty normal.
Okay. Never been told you had osteoporosis, anything like that?
No.
Okay. All right. So skin. Any rashes or wounds that we should be aware of?
No.
Treatment? Okay. Do you have any skin problems like eczema or psoriasis? Deal with anything like that?
Never have.
No skin issues? Okay. Alrighty. So that's my review of the systems. Is there anything else that I did not ask that you would like to include?
I don't think so, no.
Okay. And do you have any questions for me?
No, ma'am.
Okay. Well, next we'll be doing a hands-on focus assessment related to your IBS constipation. So what I'll be doing is checking your abdomen. And for that part, I'm going to have you lay down and we'll have your stomach exposed, okay?
Okay.
Now we'll begin our focused assessment on the patient's abdominal area. I have already washed my hands and explained the procedure to the patient. I've also provided dignity by placing a blanket over the lower half of the patient where I'm only exposing the abdominal area. So the first thing I'm going to do is inspect the abdomen area. So here I'm visually looking for any wounds, any scars, any abdominal distension that's going on, and any type of abnormal moving. And that would indicate peristalsis, which could mean that there's a bowel obstruction going on. In this case, everything is unremarkable, so we'll move on to our auscultation, which is listening to the bowel sounds. I'm going to start with the right lower quadrant here, using my stethoscope to listen. Now in this case, due to the time limits, I'm only going to listen for a few seconds. In a normal case, I will listen for a full minute, and I should be able to hear about 5 to 30 sounds per minute. So this is the right lower quadrant. And we have the right upper quadrant, the left upper quadrant, and the left lower quadrant. Now, bowel sounds are normal to hear. If you hear hyperactive bowel sounds, that could indicate a bowel obstruction. It could also indicate gastroenteritis. If you hear hypoactive bowel sounds, it could indicate peritonitis, or it could mean that they recently had some type of abdominal surgery, which is not the case here with my patient. Again, no abnormalities were detected. Okay, so next we're going to listen for vascular sounds. In this case, I'll be using the bell, which is the bottom portion of my stethoscope. And we're going to start with the aortic artery. Now what I'm listening for is a blowing sound, and this may indicate that there's a bruit, which I'm not hearing. So next we're going to listen to the right and left renal arteries. Okay, lastly, we'll listen to the iliac arteries, which will be right below the belly button. All right, everything was unremarkable. Lastly, we're going to palpate the abdomen, and we're feeling for any masses or lumps. I'm going to use one hand, and I'm going to lightly palpate. Does that hurt?
No.
Okay. And we're going to do this to all 4 quadrants. Any tenderness?
No.
Okay, we're not feeling any lumps. Now I'm going to use 2 hands to deeply palpate. Again, all 4 quadrants. Any pain?
No.
Okay. Does that hurt?
No.
Okay. Pain may indicate that there is an inflammatory underlying condition, but in this case, we detected no abnormalities here, and we have concluded our focused assessment. I will now wash my hands and let the patient know that they can cover themselves back up.